designate is for the PhD program. It's basically it's the whole program consists of 10 lectures. The first lecture is we say is just I want to introduce the advantage of Chinese medical clinical oncology and how to integrate our knowledge to the current clinical practice. I want to the participant, our student know if we have a reason, we have room to learn this subject or not. Why we need to learn these things. So the second project lecture will be the pathophysiology theory of Chinese medicine. So really what we interpreted, how the cancer starts, and how the detailed pathophysiology, what we explain in the Chinese way. That's the second lecture. The third one, to recall the lost immunity and how we change the microenvironment or macroenvironment for the tumor, for the body. So that's how I introduce the Shenxiang therapy, which means Shenxiang Wentong therapy. That's what I carry out the bigger therapeutic principles and the detailed modality how to deal with cancer. The number 4 lecture will be the clinical management, like for the breast cancer and the prostate cancer. So the following 5 lectures, like we focus on lung cancer, brain cancer. Number 6 will be the lymphoma, multiple myeloma, and the leukemia for blood cancer. The lecture 7 will focus on gynecology cancer, especially for cervical, endometrial carcinoma, ovarian cancer. Number 8, we focus on GI tract, like esophageal cancer, stomach cancer, colon cancer, sure, the pancreas cancer or liver cancer, that's maybe we'll mention some. Number 9, will how to deal with the chemo-induced peripheral neuropathy. How do we mitigate it or relieve that? That's actually a very big project, not only for the cancer field, for so many patients who suffer from idiopathic neuropathy. Also can be use these principles to explain or to discuss. The number 10, the 10 lecture will be the chemo-induced like a neutropenia, thrombocytopenia, like this side effect management and the summary. So that's basically the 10 lecture how I arrange it. So the first, we do go through the introduction. So there's when I talk to our colleagues, our friend, I found there's so many basic concepts they confused. That's why I arranged this slide. You can see, so what is really cancer? So what in Chinese medicine we think was a cancer, but that's a lot of different. Cancer we know that's a group of cells continually proliferation without stopping. That's from the immunology. They said that cancer is because immune systems failed to screenize to let the cancer grows. The tumor knowledge, tumor, we call them the oncologists always think the tumor is so multiple talent. They enslave the immune system. They control. They create their own environment. That's what genetic knowledge. Genetics said that is caused by gene mutations. But this all from different. Even the evolutionists will say cancer is from the evolutions. They became a evil spirit. So all this different. The cancer actually, what I think is from the as a terminal program. Just since we're born, they already planned it in our body. The tricky thing is how could we? So The tricky thing is how could we delay this program to start to make sure the cancer not came too early. This program don't start too early. So that's a trick. Cancer actually is a group of more than 200 diseases. So that's you cannot use just one formula, one magic bullet for all of this. So so that's why if the cancer, if our body is so integrated, so balanced, which we claim the yin-yang balance, this terminal program will not start early, will be delayed. So that's why yin-yang balance, 5 organs, qi xie balance, with joyful heart, soothing liver energy, all this count. Okay. All will be count. So, but what is Chinese medical oncology? Actually, Chinese medical oncology, with lack of systematically, that's actually a problem. From the Yellow Emperor, 就黄帝内经, like to 伤寒类, to 金匮要略, to 千金药方, so from the Chinese classical medical record, there was a lot of similarity of the cancers. They may not use the cancer this concrete like a terminology, but they do have, like in 内经, they have a 长痰, 增加, 急剧, 骨租, so many names, actually just similarity as what we call them, like a liver cancer, uterine cancer, oral cancer, very many. So for the theory, they know there's from a cold originally, from a cold causes yang qi blockage, then cause blood stagnation, then form to that, cause wei qi or rong qi be tangled together to form a tumor. So they have a very primary theory to explain that, very profound theory, but also they have a huge amount of herbal formulas to deal with that. So like in 内经, they don't have too many formulas, only certain formula, but in the 伤寒类, like a 别甲煎丸, 麻黄生麻汤, and 抵挡汤, many they use for cancer treatment is very, very effective. Like a 别甲煎丸 for liver cancer, many. So Chinese medical oncology, they have so much theory, like so profound, from their theory to their clinical practice. But our shortcoming is no systematically. We knew there's a blood clotting, we knew there's mucus, we knew there is a toxicity, toxins accumulation, but the lack of systematically, that's their shortcoming. But they do have so many ways to handle the cancers, to treat the cancers. So that's a general introduction. For the benign tumor or malignant tumor, this benign tumor is not aggressive. Like as many people now we know, thyroid cancer has been, incidence seems very high lately, but because the diagnostic technique improved. So, but benign thyroid cancer, most is not so aggressive. The benign is not nicer, normally not aggressive. Malignant can be, but the malignant tumor can be also different. Some is very aggressive. We call them high grade. When you read the report, high grade, that's very aggressive. Some we describe as a poorly differentiate cancer cells. Yeah, that's the same meaning. Poorly differentiate or well differentiate. The cell more well differentiated is more less aggressive. But if it's called a high grade tumor, that's very aggressive. Okay, different way to express the benign or malignant. So that's a basic conception. But how do we classify cancer? Normally we call cancer, that's cancer diagnosis is always based on the pathology, like an image diagnosis. You said, "Oh no, well, I saw the CAT scan, the tumor," but you see the tumor, you don't reach a final diagnosis. Diagnosis in the modern clinical oncology always based on the pathology diagnosis. So what we call cancer most means it's on the epithelial cells malignancy is called cancer. But in the soft tissues, we'll use a sarcoma. The cancer or carcinoma is the same. Sarcoma is most in the soft tissues, like fatty sarcoma, bone sarcoma, muscle sarcoma, this fatty tissue. Kabucho sarcoma in a carcinoma, no, this different tissue. That's for blood cancer, like happening in the blood cells, leukemia, all type lymphomas. We use the bone marrow like cancers. It's different. Okay, that's based on where the cell original from, but they generally is a epithelial cells, tissue, adeno. All these belong to cancer. In the soft tissue, it's carcinoma. We call them. That's generally okay. But how to stage cancer patients? We saw the TAM, right? That's a system. T is tumor, A is nodular, M is metastasis. So here there's a slide. It's a standard slide how we use that. Normally, when we read the blood test report, the patient brought the pathology report, you can see that T, there's a number, right? T1, that's a tumor small size, still small size. T0 is the main tumor. They cannot find it, but they suspect the tumor. T1, T2, T3, T4. That's the whole thing. T4 is very big. It's a local tumor, very big. That's you can see a T2, breast cancer T2, which means this cancer is tumor in the situ already like a certain size. It can find it, can palpate it, and if it A0, there's no nodular involved, no lymph node. The regional lymph node, how many? Like normally tell you, okay, the surgeon check the 16 lymph node, only find one positive. That's already like stage 2. So any like cancer from the original, like in situ, go to a local tissue, close local tissue, that's already stage 2. If they metastasize to other organ, no matter what organ, a different organ, that's a stage 4. So that's why stage it's not so strictly. That's why we would rather use the T, tumor size, nodular, how many involved, and metastasis not. Normally, the distant metastasis is the stage 4. That's a very vague, not that precisely. What it means the metastasis here? Metastasis, like originally breast cancer cell goes to the bone, but on the bone, this still from breast, still have breast cell, breast cancer cell, this characteristics. It's not a bone cancer. That's a different. If breast cancer metastasis to lung, it's not lung cancer. The cell originally still derived from the lung. To the brain is not brain cancer. It's different from the glioblastoma, from the brain tissues, different, okay? That's a metastasis. Normally you think patients say, okay, always be scared. I said, okay, doctor, my cancer metastasis already spread. Actually, it's a scared, but most time you can think, like a new people, one person from his original place to move to a new place, try to develop. Actually, it's not so easy, right? He has to develop every relations and to getting to grow big. If we involved properly, we can kill them very easily, right? So sometimes when the people's immune system like collapsed, Then what happened? One patient can have 3 or 4 different cancer cells, cancer type. That means they are not actually metastasis. Like I have one patient, a man who has a lymphoma, and we treat the lymphoma well. Then I find that he has stomach cancer. Stomach cancer, okay, prostate cancer. Then you know how crazy. That's just the body look like whole kingdom collapsed. It can collapse from anywhere. So you can see for that kind of case, our Chinese medicine really best is to help. So for example, here is a graphic from the medicine net. So the primary cancer can be, if your body collapsed, it can happen anywhere. It can have bone, either cancer, lung cancer can metastasize to bone, metastasize to brain. We know, later we'll discuss very detailed, lung cancer generally pathologically can have adenocarcinoma, can have a squamous carcinoma, can have a small cell carcinoma. But one of the adenocarcinoma very often metastasize to brain. So that's a lung cancer go to brain to growth. Lung to the bone, like people have the rib cage, so painful, a vertebrate, cancer painful, then you have an idea, okay, that's a main, especially when you clinical treatment, you have a back pain patients, like a left shoulder painful a lot. You give them treatment like acupuncture, it seems to work, it seems not. And when you give her or him for a while treatment without much improvement, you have to push patient to do X-ray. Why? He may have lung cancer. That's very common. You said, Dr. Zin, you suspect lung cancer, why they don't have a cough? Yeah, they don't need to have a cough. They show up just, some cancer just show up in the situ, maybe no symptoms. I treated one lady as a Memorial Hospital nurse. She came to me just a lower back pain. Then I traced back, is one nasty breast cancer, inflammatory breast carcinoma, ductal carcinoma. So this, you can see this can be everywhere. So we need to have the think with the thought, okay? Can have adrenal gland carcinoma, or adrenal gland, if lung can metastasize to, lung cancer can metastasize to there. They can also metastasize to liver. So that's the metastasis. The old original cancer cell move to there. It's not from the other organs, okay? So that's a generally idea, what is the cancer, what we think about the cancer, and what basically terminology, when you read the patient's like a report. So you have to know all this, and you don't need to be panic, because what we deal with is the patient's detailed symptoms.